A craniotomy is the surgical removal of part of the bone from the skull to expose the brain. Specialized tools are used to remove the section of bone called the bone flap. The bone flap is temporarily removed, then replaced after the brain surgery has been done. Craniotomy procedure method. Patient is prepped, placed on the operating table, and general anesthesia is provided. Head is shaved and prepped with an antiseptic. Incision is made, usually behind the hairline, but another location may be incised based on the site of the problem. Head is placed in a fixation device to prevent head movement. Scalp is pulled up and clipped to control bleeding, allowing access to the brain. Burr holes are made in the skull with a medical drill. A special saw called a craniotomy may be used to cut the bone. Cut bone flap is then removed and set aside. Thick outer covering of the brain, called the dura mater, is separated from the bone and cut open to expose the brain. Excess fluid is allowed to drain out of the brain if necessary. A surgical microscope or other microsurgical instrument may be used to magnify the area being treated. Tissue samples may be sent to the lab to be tested. A drain or special kind of monitor may be put in the brain tissue to measure the amount of intracranial pressure. Surgery is complete. The surgeon sutures the tissue layers closed. The bone flap is returned to its original location, and plates, sutures, or wires are used to secure it permanently in place. The bone flap may not be replaced if a tumor or infection in the bone is found, or if decompression is needed to reduce the pressure. If the bone flap is not replaced, it is called a craniectomy. Sutures or surgical staples are used to close the skin incision in the scalp, and a sterile bandage or dressing is applied. Electrocorticography. Electrocorticography, ECOG, or intracranial electroencephalography, IEEG, is a type of electrophysiological monitoring that uses electrodes placed directly on the exposed surface of the brain to record electrical activity from the cerebral cortex. Craniotomy with elevation of bone flap, for lobectomy, temporal lobe, without electrocorticography during surgery. With electrocorticography during surgery, the temporal horn of the lateral ventricle and the hippocampus are identified. The pia is next encountered and is incised and opened, and the temporal lobe is removed, including any part of the hippocampus, amygdala, and uncus that are to be removed with the temporal lobe. With the temporal lobe removed, closure is begun by suturing the dura and replacing the bone flap into position. Electrodes are prepared and placed on the brain. The electrical activity of the brain is recorded and mapped while the cortex is kept irrigated. Craniotomy with elevation of bone flap, for excision or coagulation of choroid plexus. The physician excises or destroys the choroid plexus. The choroid plexus produces spinal fluid. The physician cuts and retracts the scalp in the affected region. A bone flap is raised and tissues are dissected to the ventricle where the affected choroid plexus is located. The choroid plexus is resected, or destroyed using electrocautery. The bone is replaced and stabilized. The scalp is anastomosed and sutured in layers. Craniotomy with elevation of bone flap, for excision of craniopharyngioma. Craniopharyngiomas are brain tumors that usually develop near the pituitary gland and hypothalamus. The physician cuts and retracts the frontal scalp and raises a bone flap. The tissues are dissected to the sella turcica, and the craniopharyngioma is resected. The bone is replaced and fastened. The scalp is anastomosed and sutured in layers. Craniotomy with elevation of bone flap, for subdural implantation of an electrode array, for long-term seizure monitoring. The physician implants electrodes in the subdural layer for long-term seizure monitoring. A bone flap is elevated to implant a subdural electrode array along the cerebral hemispheres. The bone is replaced and stabilized. The scalp is anastomosed and sutured in layers. Craniotomy with elevation of bone flap, for removal of epidural or subdural electrode array, without excision of cerebral tissue. The physician removes an electrode array located in the subdural layer. The bone flap covering the electrode array is elevated and the array is removed. The bone is replaced and stabilized. The scalp is anastomosed and sutured in layers. Craniotomy for craniosynostosis, frontal or parietal bone flap. The physician performs a craniotomy for craniosynostosis. Craniosynostosis is a premature closure of the sutures of the skull. The physician incises and retracts the scalp over the fused suture lines. The frontal or parietal bones are removed. Craniotomy for craniosynostosis, bifrontal bone flap. The bones are reshaped and a bone flap is created from the harvested bones to enlarge and reshape the skull. If the dura mater was damaged during bone harvest, it is sutured closed. The reshaped bone flap is positioned and secured to neighboring bone. The scalp is reanastomosed and sutured in layers. Craniotomy for hypophysectomy or excision of pituitary tumor, intracranial approach. The physician uses a craniotomy to remove a pituitary tumor or resect a portion of the gland. The physician cuts and retracts the frontal scalp and raises a bone flap. The tissues are dissected to the sella turcica, and the pituitary is identified. The tumor or hypertrophic gland is resected. The bone is replaced and fastened. The scalp is anastomosed and sutured in layers. Hypophysectomy or excision of pituitary tumor, Trans-Nasal or Transceptal approach, Non-Stereotactic. The physician accesses the base of the sella turcica through the nose. The incision may be made in the mouth underneath the upper lip to avoid facial scarring. A small hole is drilled in the skull base through the inferior aspect of the sella turcica. The pituitary is identified and the tumor or hypertrophic gland is resected. The hole is packed with gel foam, with or without bone chips. The nasal and oral mucosa are sutured closed. Craniotomy for repair of dural/cerebrospinal fluid leak, including surgery for rhinorrhea/otorrhea. The physician repairs a dural/cerebrospinal fluid leak. The physician determines the location of the skull fracture using an MRI scan. The skin over the damaged area is incised. A bone flap is removed to access the dura, which is sutured closed. The bone flap is replaced and stabilized. The scalp is reproximate and sutured in layers.